Hi, I'm Dr. Mary Barbera, autism mom, board-certified behavior analyst, and best-selling author. I'm often asked by both autism professionals and parents how much of an impact they can make in 15 minutes or an hour or two of ABA therapy per day, or even an hour or two per week. Many studies have been done on applied behavior analysis therapy, but most studies have been done with 20 to 40 hours of ABA therapy per week. That's 4 to 8 hours of therapy every weekday for 2 or 3 years. Fortunately, insurance coverage for ABA in many areas within the United States is improving, so many children are receiving these large numbers of ABA therapy per week, which is really what is recommended. But there are usually deductibles and waiting lists, and many parents in parts of the United States and for most of the rest of the world aren't getting 20 to 40 hours of the ABA therapy per week. It's just not possible. In my opinion, the best thing you can do with 1, 2, or 5 hours a week is make sure you are training others during those hours. The worst thing you can do as an SLP or BCBA or tutor is to say, okay, Johnny, it's time for your speech therapy or your ABA time. Come back with me, come into my office, come down in the therapy room in the basement. Mommy, you wait here because he gets way too distracted if you're here. So come on, Johnny, sit with me and I'll do speech therapy or I'll do ABA therapy with you. Meanwhile, mom is sitting in the lobby or up in the kitchen during ABA time. She has no idea what you're doing. She doesn't know how to interact. She doesn't know how to teach her child important language skills or reduce problem behaviors. So the fewer the hours, the more parent and caregiver training you're going to have to do. And if you're in school working, say as a speech therapist again, don't just bring the child in to work alone with you in your office. If at all possible, bring the aide in too. Or do speech therapy within the autism classroom so everyone can watch. Bring whoever's going to be with the child more than that 1 hour a week into your therapy session, and that's the way you're going to teach this person to fish, not just give them a fish, because these children with autism need a lot of ABA therapy during all their waking hours. And you know good techniques, so you want to spread these techniques. And it just doesn't have to be at the table either. These ABA techniques can be used outside, in a grocery store, in the car, in the bathtub, getting a child's hair cut. And we just need to structure it so that if you know, depending on the child's age, how much is reasonable to sit at the table. My clients sit at the table for over an hour at a stretch, which may sound like a long time, but we work up to that gradually, and they love the table. We often start out with just 15-minute sessions per day at the table. And these clients and children can really learn to love table time. I do have a free 75-minute online workshop called 3 Big Autism Therapy Mistakes and What to Do Instead. By clicking the link below, you'll be able to register for this free online workshop. Thanks for watching, and I'll see you next week.